Welcome back to SJG Perspective. How are you guys doing this fine evening? In this segment, episode, whatever you may want to call it, we're going to talk about asymptomatic spread and a very interesting study that was done in China on 10 million people back in November. Well, it was actually done back in May. The study came out in November, and they did a study of 10 million people to find out how dangerous asymptomatic spread is. I'm not going to spoil it for you. We're going to have to get into this, but you're going to want to stick around and hear what this study had to say. It was pretty important. Quick disclaimer to YouTube. I am simply going to talk about very impassionately about an article and a study that was done. So don't shoot the messenger, YouTube. But in case YouTube decides to shoot the messenger, you guys should go over to SJG, yes, sjgperspective.com and subscribe to me over there. That way YouTube can take a flying leap off a very short pier that's way up high in the air and that only has rocks below it. Not like a regular pier where you just jump into the water, but like a really high cliff with a bunch of jagged rocks below it. You know, that's the jump I want them to make. If they try to kick me, take me down, because I'm one strike away from losing it all. I'm one strike away from almost 3 years of working on this channel and building it up to be taken away from Susan Wojcicki and her totalitarian Nazi, think right Nazi staff. They're about ready to take my channel down. So please go to sjgperspective.com and you can find all the other places that will never do that because they're not DWs. And I think we covered in the last couple videos ago what DWs are. Dickwads. So these other places aren't DWs, unlike YouTube. And so go follow me there. Okay, enough with all that. That's 2 minutes. 2-minute opener. Probably more time than some people get so annoyed that I do that. Who cares? It's my channel. You don't like it? Leave. I don't care. YouTube takes people who are many all the time. So what do I care if you leave? I don't anymore. If you want to be here, I want you here. If you don't, there's the door. Hit it. Okay, asymptomatic transmission of COVID-19 didn't occur at all. Occur at all. Study of 10 million finds. Only 300 asymptomatic cases in the study of nearly 10 million were discovered, and none of those tested positive for COVID-19. 10 million person study, right? We're going to get to that study too. Don't shoot me, YouTube. I'm not the one who did this study. Where's it at? There it is. It's Nature's Communications. It's the actual all scientific-y and shit, right? It's an abstract paper, right? And they got all the results here. Don't get mad at me. Don't get mad at me. It says Wuhan, China, December 23rd. A study of almost 10 million people in Wuhan, China found that asymptomatic spread of COVID-19 didn't occur at all, thus undermining the need for lockdowns, which are built on the premise of the virus being unwittingly spread by infectious asymptomatic people. Published in November in the scientific journal Nature Communications, the paper was compiled by 19 scientists, mainly from Huzhong University of Science and Technology in Wuhan, but also from scientific institutions across China as well as in the UK and in Australia. It focused on the residents of Wuhan, ground zero for COVID-19, where 9,899,828 people, that's a lot of damn people, took part in a screening program from May 14th to June 1st. Which provided clear results as to the possibility of any asymptomatic transmission of the virus. Asymptomatic transmission has been the underlying justification for the lockdowns enforced all across the world. The most recent guidance from the Centers for Disease Control, the CDC, still states that the virus can be spread by people who do not have symptoms. In fact, the CDC claimed that asymptomatic people are estimated to account for more than 50% of the transmission. Now, if the CDC said it, we probably should not argue with them because they have never flip-flopped people on things like masks, whether you should wear them or not. They would never flip-flop on that. Transmission, whether or not it's like aerosolized or not, it's got to be droplets, or it can be fine little mist in the air, or that it can stay on surfaces for up to 5 years, or I'm being facetious, but for a very long time. They haven't flip-flopped on your social distance. It didn't used to be 3 feet and then jump to like 9 feet and then settle somewhere in the middle at 6 feet. They didn't jump back and forth on that. They knew what they were talking about. They never misled on any of the death counts either. The CDC never has done that, right? And they especially the CDC did not set the testing cycle threshold of 37 to 40 CT cycle threshold, right? When it comes to the PCR testing, that is not had a very high, that does not have a high false positive rate on it at all. The CDC has not pushed any of these things. So we should believe exactly right now what they're telling us. The UK Health Ministry Secretary Matt Hancock has also promoted this message, explaining that the concept of asymptomatic spread of COVID-19 led to the UK advocating for masks and referring to the problem of asymptomatic transmission. However, the new study in the Nature Communications titled Post-Lockdown SARS-CoV-2 Nucleic Acid Screening in Nearly 10 Million Residents of Wuhan, China, debunked, the concept, of asymptomatic transmission. Why don't we go over here and why don't we just read a little bit of what they had to say here. Here's the abstract paper. I don't know if you can read it. Probably can't. Doesn't really matter. It says stringent COVID-19. The abstract. This is it. The stringent COVID-19 control measures were imposed in Wuhan between January 23rd and April 8th, 2020. Estimates of prevalence of infection following the release of the restrictions could inform post-lockdown pandemic management. Here, we describe a citywide SARS-CoV-2 nucleic acid screening program between May 14th and June 1st of 2020 in Wuhan. All city residents aged 6 years or older were eligible, and 9,899,828, or 92.9%, participated. No new symptomatic cases and 300 asymptomatic cases. Detection rate of 0.303-/10,000, 95% C, I don't even know what those numbers mean, were identified. So just taking all that scientific talk out of it, 300 asymptomatic cases were identified out of 10 million were identified. There were no positive tests among 1,174 close contacts of asymptomatic cases. I'm going to read that again. There were no positive tests among 1,174 close contacts of the 300 asymptomatic cases. 107 of 34,424 previously recovered COVID-19 patients tested positive again. The prevalence of SARS-CoV-2 infection in Wuhan was therefore very low 5 to 8 weeks after the end of lockdown. Here's the results. Let's see how long we can get. See if they give it a... Okay. I'm not going to read all those results because essentially I just told you what the whole results were. See if they have just a summary down here, a conclusion. They can go through all the methods, the discussions, the definitions, data availability, the references that they used, statistical analysis. Detection rate of asymptomatic positive or repositive cases was calculated by dividing the number of individuals with a positive test of nucleic acid testing by the number of participants tested. Because of extremely low detection rates, we calculated the 95% confidence intervals of estimated proportions using Pearson-Klopper exact methods implemented through our package Binom version 1.1-1, SPSS version 22.0, that just sounds smart, was used for other statistical analyses. We analyzed the distribution of asymptomatic positive cases and assessed the Spearman correlation between the asymptomatic positive rate and the prevalence of previously confirmed COVID-19 cases in different districts of Wuhan. Wow, that's a lot to read. Differences in the asymptomatic positive rates by sex and age groups were addressed using the X2 test. Not the X3, not the X1, the X2 test. ARGIS 10.0 was used to draw a geographic distribution map of asymptomatic positive cases. A value of greater than 0.05 or less than 0.05 was considered statistically insignificant. All of that stuff that I just read you, I thought was going to be a summary. Seemed like a lot of scientific talk. Ultimately, don't believe me, go read the whole thing yourself because I did read it. I just don't think after you being following me here for 9 minutes, you're going to want me to read much more of that. They did not find any kind of asymptomatic really spread, anything to really worry about, right? Which has led to some of these other things like, well, the World Health Organization walks back its claims back in June. It says the World Health Organization walks back claims about asymptomatic spread. We don't hear about that, right? And then we see in CNBC back in June, too, asymptomatic spread of coronavirus is very rare, World Health Organization says, right? We don't hear about that. We're all locking everybody down to save grandma. This can't be all true, right? This can't be CNBC saying this, right? Or the World Health Organization saying this and CNBC covering it, right? We can't have scientists here in Wuhan that are getting all graphy and shit, doing all these numbers and points and zeros and results and bling, bling, blang, bloom, blop, right? We can't have 10 million people tested that don't show 10 million people in Wuhan, the heartbeat of it, where the whole China virus started, right? We can't have 10 million people that weren't asymptomatic. That doesn't make sense. I don't know if I believe this. I'm sorry. I don't know. It just sounds like it's not true. American Institute of Economic Research, asymptomatic spread needs to be revisited. This is a great article by Jeffrey Tucker, written on November 22nd. Right? These are the things that we need to ask ourselves, people. These are the things that we need to push back on and we need to talk about. Because these are the things pushing all of the craziness around our world right now that we see. And unless we want to get back to normal, truly normal, which losing faith is ever going to happen. But I'm not going to lose complete faith. We have to wake up to this and spread this kind of information. And that's why YouTube, aka the DWs over at the YT, right? The DWs at the YT, they don't like what we're saying. Or the old FB or the old TW. They don't like what we're saying and they're shutting us down because this is the kind of information they don't want out there. They don't want people knowing about this. This is not the kind of information they want people to know. But this is the kind of information you need to know so you can tell your friends, your family, your loved ones. You can lead people to the water and help them understand it and help them look at it and help them see it. Okay? So, having said that, I would like you guys to go over to SJG Perspective and subscribe. I have my new song I just put over there, Rise Up. It talks about that very thing, rising up. Love it if you guys want to support me. If you want to download it, pay $1 or $2, download it. I'd be greatly appreciated. But if nothing else, share, please. Share it around. And you can download it for free too. So, totally up to you. But I think that's about it. So until next time, without fear or animus, right? It's SJG Perspective. And we will talk to you guys really soon. So be brave, be strong, keep your head up, and keep reaching for those damn stars. And look out for asteroids on the way, because apparently those are coming now too. So SJG Perspective, without fear or animus, we'll talk to you later. Have a good night. Bye.